Welcome everyone. I'm Madhu. I'm excited to talk about our new product, Flow Auth. Let's spend a minute talking about the history of prior authorization. As we know, prior authorization is not a new process. Its root trace back all the way to 1960s when Medicaid and Medicare were first launched. Back then, the focus was on utilization reviews, essentially getting a second opinion from another doctor before a patient is admitted to a hospital. The goal was to really prevent unnecessary hospital stays and control costs. Since then, obviously, prior authorization has expanded beyond hospital admissions. Today, prior authorization touches a lot of healthcare services, from surgeries to diagnostic tests to prescriptions and even mental health services. What started as a safeguard to ensure necessary care was delivered has now evolved to this complex process that touches every step of a patient journey. What is the current state of prior authorization? There's a lot to talk about in here. It's not a stretch to say that today, for many practices, this is a daily grind. It is also a single most contributor to a physician burnout. In fact, 89% doctors directly link prior authorization to their burnout. On that, the number of prior authorizations are increasing at an alarming rate. In fact, the Kaiser Family Foundation said in 2023, Medicare Advantage insurers handled nearly 50 million prior authorization determinations. And on that, the process itself is murky. More than 62% of providers and staff don't know upfront if a service requires a prior authorization because the rules are constantly changing. And what worked a month ago doesn't necessarily mean will work today. This requires them to retrain themselves, their staff, over and over again. And the submission process is a chaos. Every payer has a unique process with a different portal. The phone trees are long, and at the end of it, sometimes you don't even get to a resolution. The faxes are lost in paperwork, and the teams are dealing with sticky notes. So overall, the process is very manual and tedious, and the consequences are real. Prior authorizations lead to patient care delays, and overall, overutilization of healthcare resources to resolve prior authorizations. The patients are also dealing with financial burden because they're forced to pay out of pocket and, in some cases, even forgo the treatment. What that means is it leads to more hospitalizations and ED visits. Sad part is a lot of practices and health systems are now forced to hire teams to exclusively work on prior authorization. So this talented team members and resources, these mission-oriented, are now forced to spend their time answering phone calls, making phone calls to health plans instead of focusing on patient care. This process is not just inefficient, it's unsustainable. Mike, you spend a lot of time with health system leaders on these challenges. What are you hearing on the ground?
Yeah. Thanks, Madhu. I'm Mike. I'm hearing very similar things to what you're talking about, to the point where I recently visited with the chief medical officers of a medium-sized health system. She said it's gotten to the point now where her staff is spending as much time on the administrative duties, much around the prior auth, that they do in actually the treatment and care for their patients. And I think this is becoming a real problem. And I think they're seeing it in all the different elements of our healthcare system here in the U.S. I kind of put it into three different categories of what I'm observing, how people are going after this. The first is kind of the community-based services, smaller health systems. They're just hiring people, like you mentioned. They're hiring people, they're putting them in front of a portal, generally the payers' portals. They're using Excel spreadsheets to keep track of all the different rulings and all the new rules that are coming out. They have abundance of sticky notes, which are very clever on how they do the color coding, but they're not making progress against this. We're still, transactional cost is about $25, maybe $30 per transaction, and there's millions of those. This is driving lots of costs in the healthcare business. And I think back, I used to work in the travel industry, and in the early 2000s, both of you are too young to remember, but there was a day you had to call somebody to book a flight or book a hotel, or I worked for the cruise lines. That was all chasing a $25 booking fee. They're gone now today, and the whole industry transformed because of that. Something like that could be happening here. The second group of folks that I see going after improvements in here is generally the offshoring. Well, this is going to be a manual process. Let's at least find cheaper labor. So they're doing offshore techniques on that. And they're getting reduction in rates of 25 to 30%, but really no improvement in the outcomes, like faster processing of those, nor the reduction in the actual workload. So great, we're saving money, but we're not making progress in this. And the third one, there's a bunch of brave souls out there that are going after it from a technology perspective. They're taking advantage of, again, those portals. They're using some screen scraping technology, which has been around for quite a while. They're using those Excel spreadsheets I mentioned, and they're getting some progress as far as productivity in processing this paperwork. But there's a limitation to that. I think what we're seeing is about 35% of the transactions for prior authorization can be automated. That leaves a huge gap of the other 65%. I think is a bit abysmal. I think we could do a lot better. The irony is, and what really gets me is, the payers want nothing but the best care for their members. The providers, have committed their lives and their careers towards caring for people, and the patients and the members just want to be healthy. So we have to be able to find a better way to get this system to work.
All of these that you talked about are really band-aids, right? We really need that interplay between a provider and a payer needs to be really tighter for this process to work. This is why we built Auth. Flow is our AI-powered financial performance platform, an integrated AI workforce that's designed to optimize your revenue cycle from scheduling to the final payment. Today, we're launching Auth, tackling healthcare's most frustrating bottleneck. We didn't start with technology. We started with understanding every step in the current process, again and again, with different clients, with different health systems, in different scenarios. And from there, we reimagined it with AI, how to make this simple, efficient, and transparent. Here are a few highlights of what Auth delivers, starting with an intelligent knowledge base. Auth runs on a constantly updated intelligent knowledge base, which captures most up-to-date codes, payer rules, and requirements. Auth identifies prior auth early on. In many scenarios, our clients are submitting prior auths for services that prior auths aren't required. Auth has an ability to identify if prior auth is required for a service early on, avoiding any delays and rework. Medical necessity review and smart packet generation. For the prior auths that are not approved automatically, Auth does a medical necessity review by pulling the most up-to-date payer rules and matching them with patients' clinical information to make sure the submission criteria is met, and then creates a smart package to avoid any delays and denials downstreams. Caller agents. We know that every workflow cannot be automated. For the workflows that require phone calls to payers, let our AI caller agents take care of it so that your teams are freed up to do more meaningful work. Real-time analytics. Auth provides insights into approval rates, payer performance, denial codes, denial trends, turnaround times. All of this can be leveraged to make the overall automation even better over time. Now, why don't we see this in action?
I'm Becky, and I'll be demoing our Flow Auth and how we automate the prior authorization process. Our solution is integrated within your EHR's workflow, allowing your team to stay within the EHR. Here you can see a patient list, and Joy is coming in to visit her cardiologist today. She has hypertension and has been experiencing heart palpitations and shortness of breath. During her visit, the cardiologist suspects heart failure, and he places an order for an echo along with a couple other orders for Joy. Joy is pretty anxious given the news and is concerned about getting her echo as quickly as possible so she can get clarity on her diagnosis. Our agent steps into action and immediately starts identifying the orders that likely require prior auth. Here we can see the agent picked up 2 orders. Let's check out the request for the echocardiogram. So here you can see in the background, the agent is automatically working, going through all the steps that your team manually prepares and goes through today. The agent starts by verifying the patient's insurance. It's confirming that the insurance is active and that Joy has the covered medical benefit for the echo. This ensures that your team is not working on prior authorization requests for insurance that is inactive. As Madhu mentioned, when payers don't support real-time eligibility checks, we handle those nuances and can deploy a caller agent. So here you see the transcript between our eligibility agent and the payer representative verifying Joy's insurance. The next step in the workflow is confirming that prior authorization is in fact required. We'll go ahead and access our knowledge base and check out the specific payer rules and confirm that prior auth is required. From there, the agent will handle a medical necessity review. This is done when packets will not be auto-approved. So the agent will go and access the guidelines that are specific for that payer, for that diagnosis, for that order, and conduct a medical necessity review, evaluating the patient's clinical data against those guidelines to flag where the patient meets the criteria and where they don't, ensuring that submissions are payer-specific, reducing rework and denials. Once the agent completes the steps, the prior authorization packet is ready for your team to review. Here we highlight the key steps that the agents completed for your staff. They can quickly see that Joy's insurance was active, that prior authorization was required, the guidelines set forth by this payer for this echo are met, and the evidence associated with those guidelines. This helps create more transparency in a process that is largely considered a black box. Below that, we list all the details that will be shared with the payer for the prior authorization. Within the workflow, your team can review the clinical evidence that was gathered from the agent that supports the medical necessity. We also list out additional details. The agent will perform additional scrubbing to make sure that the information we are submitting to the payer matches at an ICD-10 and procedure code level, and also accounts for common administrative errors that arise. For example, if a payer has a different address on file than the one that is submitted, the payer will go ahead and send that back and the team will have to rework it. We ensure that the agent is submitting the addresses and NPIs that match on the payer side. Once the team reviews, the agent will go ahead and submit electronically, but for payers that don't support electronic submission, the agent will autofill a prior auth form that's specific to that payer. We'll then go ahead and submit that electronically via fax. After submission, all statuses flow back into your EHR, making your team aware of when scheduling can happen for these critical visits that deliver the care that's needed for patients to get the answers that they need. Back to you, Madhu.
Thank you, Becky. As you can see, the agent is pretty powerful. It also can be configured to be semi-autonomous or fully autonomous based on your organization's preference. So as you can see, this can fundamentally shift how your teams work. Flow Auth can be a true competitive advantage for your organization, enabling faster care delivery, efficient teams, and better patient experience. Overall, this also can have a really powerful impact to your bottom line. Within few months, you can expect a 5-to-1 ROI with millions in productivity gains and revenue. And most importantly, your care teams, your physicians can have the peace of mind and focus on treatment and outcomes. This is what technology is supposed to do.
And when you talk about technology, Madhu, it's interesting where we are in the journey, in the healthcare system. The technologies that Becky just demonstrated, those AI technologies are very mature now. The chat GPT being used by every kid, every student that we have here in the US, probably in the world. I think the scribing technology has been proven to be very effective. And really, we're just taking advantage of some of those same tools in getting the documentation necessary for these prior authorizations. And what's interesting, and Becky mentioned this, is that it learns. It only gets smarter. So as they get denials, they learn what data was missing, or it was an incorrect address. They can predict those and stop them from happening in the future. Because as we know, it's $25 every time we do a transaction in this particular space, and we want to stop those transactions. The second thing I think that's evolving, and Madhu mentioned this, is the costs are unbearable. I mean, the administrative costs that are going through these enterprises running these health systems, if you add it up, if you're doing 1,000 PAs a month, that's somewhere between $200,000 to $500,000 that is not going towards patient care. It's administrative, bureaucratic processes that could really be reduced. So when you go to your CFO and ask for funding in this particular area, this is a very good payback. So we have the technology that's evolved. We have the math works that makes this a good investment. And then thirdly, the government with CMS and the new ruling coming out in 2026, they're mandating certain SLAs and responsiveness around prior authorization requirements. I think we have all the right ingredients, and this is why we built FlowAuth. FlowAuth is going to remove this bottleneck, this large expense, and then help us focus on consumer satisfaction within our healthcare ecosystem.
Couldn't agree with you more, Mike. The time is now. FlowAuth can transform a broken process into a competitive advantage for your organization, where physicians can practice medicine, teams can do meaningful work, patients can get timely care, and organizations can capture revenue. This is what prior authorization should look like, and with FlowAuth, it can. Visit go-flow.ai to schedule your personalized demo. See FlowAuth in action with your peers, with your workflows, and with your challenges. Thank you for joining us today.
Manual prior authorization delays care and increases burnout. FlowAuth automates the entire process. The moment an order is placed, FlowAuth verifies coverage automatically. Our AI knows what each payer needs and assembles the perfect packet. Progress notes, labs, imaging, pulled straight from your EHR. Matching every requirement before submission, necessity, guidelines, evidence. With one click, it submits to the payer's preferred channel, APIs, portals, or fax. Then, FlowAuth keeps watch, tracking status in real time, so you never waste time on hold. If a request is denied, FlowAuth drafts an evidence-based appeal to help you get approvals faster. Cut processing time, improve staff productivity, and fast-track patient care. FlowAuth, AI that does your prior authorizations end to end.